Welcome to Massage Effects, Safety, and Final Review. In this final lesson, we will connect anatomy and physiology with responsible massage practice. Understanding the body is not only about remembering structures and functions. It is about using that knowledge to make safe, appropriate, and professional decisions. Let's begin with the effects of massage. Anmorchaling. Massage applies mechanical and sensory input to the body through pressure, movement, stretching, temperature, rhythm, and human contact. Some effects may occur locally in the tissues being touched. Other responses are influenced by the nervous system and the client's overall experience. Immediately after massage, a client may report greater comfort, decreased stiffness, temporary reduction in pain, improved ease of movement, or a feeling of relaxation. These responses are real, but they vary among individuals. The same technique may feel relaxing to one person and uncomfortable to another. Pressure, speed, duration, body position, environment, previous experience, stress, sleep, expectations, and communication can all influence the response. This is why massage dosage, anmorchaling, is important. Dosage includes the amount of pressure, speed of movement, treatment duration, frequency, area treated, and the client's tolerance. More pressure does not automatically produce a better result. The most appropriate dosage is the amount that supports the treatment goal while remaining safe and acceptable to the client. Massage therapists should use accurate and modest language when describing treatment effects. It is appropriate to say that massage may support relaxation, comfort, body awareness, or a temporary improvement in movement. It is not appropriate to claim that massage removes toxins, permanently breaks up fascia, realigns bones, cures disease, or guarantees increased circulation throughout the body. Evidence-based practice, Xinzheng means combining research evidence, professional experience, client preferences, and the individual clinical situation. Safety begins before the massage session. The therapist should obtain relevant health information, ask why the client is seeking massage, identify medications or recent procedures, and clarify the client's goals. Informed consent, Zhiqingtongyi, means that the client understands what will be done and voluntarily agrees to it. Consent is not a one-time signature. It is an ongoing conversation throughout the session. A client may change their mind, decline work on a particular area, request less pressure, or stop the massage at any time. Draping should protect privacy and expose only the area being treated. Sensitive regions require clear explanation, appropriate consent, and strict observance of professional boundaries and applicable laws. During treatment, monitor verbal and non-verbal responses. Guarding, breath holding, pulling away, facial tension, sweating, unusual skin color changes, dizziness, confusion, or increasing pain may indicate that the technique should be modified or stopped. Sharp pain, burning, numbness, tingling, electric sensations, or sudden weakness may indicate nerve involvement. These sensations should never be interpreted as proof that the massage is working. A contraindication, Jinjizheng, is a condition in which massage should be avoided or modified. Some contraindications are local. For example, avoid direct massage over an open wound, active skin infection, acute inflammation, recent injury, unexplained lump, or suspected fracture. Other situations may require postponing the entire session or obtaining medical guidance. Important red flags, Weishanshinhao, include chest pain, sudden shortness of breath, signs of stroke, suspected deep vein thrombosis, severe unexplained pain, uncontrolled bleeding, rapidly increasing swelling, fever with systemic illness, or new progressive neurological symptoms. When a medical emergency is suspected, stop the session and activate the appropriate emergency response. Referral, Zhongzhen, does not mean that the therapist has failed. It demonstrates professional judgment and respect for scope of practice. A massage therapist observes, assesses for massage planning, provides massage within authorized scope, documents the client's response, and refers when necessary. The therapist does not diagnose disease or replace medical care. After treatment, reassessment, 再评估, helps determine the client's response. Ask specific questions. Has the level or quality of discomfort changed? Does movement feel easier or more difficult? Did any new symptom appear? Was the pressure comfortable? The treatment plan should be adjusted according to this information, not according to a rigid routine. Documentation should be clear, objective, and professional. Record relevant client statements, observations, areas treated, techniques used, modifications made, client response, and any recommendations or referrals. Avoid diagnostic statements unless the diagnosis was provided by an authorized healthcare professional and is relevant to the massage session. Let's complete our final review. Anatomy describes structure, 解剖学研究结构. Physiology explains function, 生理学研究功能. The skeletal system provides support, protection, and leverage. Muscles generate movement through neural activation, calcium, actin, myosin, and ATP. The nervous system receives information, coordinates responses, and influences muscle tone, autonomic state, and pain. The cardiovascular and respiratory systems deliver oxygen and support tissue metabolism. The lymphatic system returns excess interstitial fluid and participates in immune function. All these systems interact. Massage does not affect one structure in isolation. Safe massage practice follows a continuous process. Observe. Ask. Obtain consent. Choose an appropriate dosage. Monitor the response. Modify when necessary. Reassess. Document. Refer when appropriate. The goal is not to perform every planned technique. The goal is to provide the safest and most appropriate service for the person in front of you. Before completing this course, consider one final question. If a technique matches the treatment plan but the client's response suggests discomfort or risk, which should guide your next decision, the original plan or the client's current response?